Let's take a closer look at the effect of aerobic exercise training on the cardiovascular system. Now, looking at these graphs, note that the change in heart rate, this is here, depends on whether the individual is trained, that's post-training, or untrained, that would be pre-training. A trained individual will have a lower heart rate at the same exercise intensity as the untrained individual. At 15 kilometers per hour treadmill speed, the heart rate is 150 for the trained individual, but we're getting close to 175 for the untrained individual. Now let's go to the graph on the right. This is looking at cardiac output versus treadmill speed. The trained and untrained individuals will have similar cardiac outputs at sub-maximal exercise. So as the treadmill speed increases, they have exactly the same cardiac output. This is to sub-maximal exercise. So on this graph, we can show the progression essentially from walking to jogging and then getting up here to running, and this would be at a higher intensity. Now note that the cardiac output increases in the trained, this is the red post-training, individual once the intensity increases to maximal exercise. So at rest and during sub-maximal exercise, the trained individual will have a lower heart rate. So going back to this graph on the left, lower heart rate. The lower heart rate is due to a secondary adaptation. During training, the left ventricle hypertrophies, essentially becoming stronger, and develops greater contractility, which forces more blood out of the ventricle with each pump. The result is a greater stroke volume. So remember, cardiac output here equals the heart rate times the stroke volume. If the stroke volume goes up, the heart rate goes down to maintain the same cardiac output. Essentially, with training, the heart pumps out more blood with each beat and therefore doesn't have to beat as quickly. That means that there's little effect on the resting cardiac output in a trained individual. So although the trained individual will increase the heart rate as the speed increases, the cardiac output is going to remain the same. And that's because the heart rate, the stroke volume is going to go up. So as the stroke volume goes up, the cardiac output goes up. But here, the heart rate is actually lower, essentially goes down. So we're going to maintain the same cardiac output. Now, stroke volume will always increase with exercise intensity, but stroke volume is limited by what? But chamber size. The heart is only so big. So therefore, there's a plateau. Aerobically trained athletes will have a greater maximum stroke volume, which means, what does that translate to? Greater maximum cardiac output. So they're going to have a greater maximum stroke volume and cardiac output than the untrained athlete, as we can see here. As a trained athlete increases intensity towards maximal exercise, the heart beats more quickly, which increases cardiac output. There are limitations with both chamber size of the ventricles. The ventricle can only hold so much blood, and the filling time. You can only fill back up so quickly. Beating too quickly is actually going to decrease filling time. So these are going to contribute to the plateau. So this is where it levels out right here. That occurs even in a trained individual.